Good morning, everyone. Thank you for joining us for today's campus update briefing, our second one for the fall semester, live from the beautiful University of Arizona. I'm Holly Jensen, Vice President of Communications. Today, Dr. Robert Robbins, President of the University of Arizona, is going to provide important information on the university's plan for welcoming most of our students back in person next week. We would like to welcome our students from the College of Law and the College of Fine Arts starting classes today. President Robbins is joined by Dr. Richard Carmona, 17th Surgeon General of the United States and distinguished professor here at the university. He will be providing updates on the current state of the Delta variant and our public health conditions in the county, state, and here on campus. We will take media questions at the end of today's briefing. Please make sure if you have a question, you type your name and news organization into the window when you raise your hand, and we will get to as many questions as we can in the time that we have allotted for today. With that, I will turn it over to you, President Robbins.
Thank you, Holly, and good morning, everyone. Thank you for joining us again. We're only 1 week away from the start of the fall 2021 semester, and our faculty and staff are excited to welcome back our students over the next several days. As you know, we expect to begin all classes in person based on the current health conditions and aligned with CDC guidance. As well as our commitment to deliver in-person learning, we are requiring face coverings to be worn in all indoor spaces where adequately and continuously maintaining social distancing is not possible. This includes classrooms, and signs will be posted throughout the campus facilities to indicate where mask and face coverings are required. Week, our expectations has been that masks should be worn by our students and employees in such indoor settings. Since last week's briefings, all 3 state universities have announced formalization of indoor masking requirements consistent with this expectation. Following a review of existing state law and in consultation with the Arizona Board of Regents, I'm pleased that we have arrived together at this joint mitigation step centered on campus safety, consistent with the law. As a reminder, the university is offering rapid antigen tests to all students and employees, and we encourage and expect you test regularly, especially if you're not vaccinated. If you're asymptomatic and wish to be tested, visit covid19.arizona.edu for information and to make an appointment. Symptomatic individuals should contact Campus Health to schedule an appointment. I want to be very clear. Our goals are to provide a robust educational experience for our students and to sustain our research and outreach missions. We are taking these other measures so that the university can remain open. The Delta variant poses a serious challenge. However, if we mask up, get as many people vaccinated as possible, and stay vigilant, we can minimize its impact. Dr. Carmona will share data on vaccination rates, COVID-19 cases in the county and state, and the campus testing programs. Dr. Carmona, thank you for going over the slides this week. We didn't have slides last week, so I'm happy to see that we're going to get into some of the data.
Go ahead, Dr. Carmona, you're on.
Thank you, Holly. Good morning, everybody, and nice to see you back again. And we're anxious to let you know about all of the planning we've been doing on behalf of the community, the U of A community, but also the surrounding community, which we work with very carefully. So if I could have the first slide, please. So again, you'll remember from last year, we spoke about the rolling averages. That's a weekly averages and cases per 100,000. If you look at Arizona at 38 and look at Pima County at 21, we're actually doing very well, among best in class around the country. And a lot of that is because of all of you who have worked with us tirelessly over the last several months to get as many people vaccinated as possible, to stay socially distant, to mask up where you can't guarantee social distance. All of those have incremental value, and it's showing in our numbers that we've been relatively successful with keeping the transmissibility of disease down. Next slide, please. And if you look at our testing results, as you can see, we haven't done much testing recently. It's been pretty quiet. The numbers are still very acceptable. As you remember from last year, we looked at a 5% threshold and below as being good. But again, these numbers are very low and it's just starting. As we move forward, you'll hear more, more about that. And obviously, we'll be doing testing and encouraging students, as you've heard the president mention, to get tested, especially when they are symptomatic. Next slide, please. So this is something, we're really proud of. If you look at our vaccination rates, that almost 62% of people in Pima County have been vaccinated. Our seniors, which are the most vulnerable, 94.2%. Again, some of the highest numbers in the whole country as far as seniors being vaccinated. And 18 and above at almost 3 out of 4 people being vaccinated is really good. And if you look at the total, we're just over half the state. So we're exceeding the state averages by a whole lot. But again, we're not complacent. We want to get everybody vaccinated for all the reasons that we mentioned over and over again. Next slide, please. So we're providing incentives, and it's one way that we hope to encourage our students, our faculty, our staff to be able to get vaccinated, and especially our students. So as you can see there, for employees and students, the different incentives that we're providing. There is evidence that incentives do work in some cases, besides the continued messaging, our explanation of the importance of vaccination and all of the public health measures that we put in place that we hope everybody will be practicing once again, which got us through last year very successfully. Next slide, please. So the mitigation efforts continue as well, as far as our disinfecting throughout our university, the isolation dorms and student isolation transportation, providing voluntary vaccinations and free COVID testing at campus health as needed for faculty, staff, and students. So at every juncture on our university, we're providing opportunities for that, our students, our staff, our faculty to make good decisions. And when they need help, we have plenty of people out there to help them. And we're working hard to keep the environment clean, as we've said, and we've done all through last year. Next slide. So we look at all of the items that have been installed. I mean, literally thousands and thousands of things, from sneeze guards to MERV filters that filter the air in the room. These are filters that are of a higher quality than average homes because of the increased transmissibility. And our incident command system run by Chris Kopak, our facilities manager, is working on this every single day, looking at different touch points where we can make sure we have all mitigation efforts in place to reduce transmission of disease. Next slide. So, Bobby, I think that coming out of last year, we've learned a lot of lessons. We kept our incident command system working, even though it was scaled down, but still monitoring and providing you information on a daily basis as to the situational awareness on the university, situational awareness in the community, situational awareness at the state and the national level, so we could always be moving appropriately with the best practices to keep our university students, staff, and faculty healthy and safe, and continue with the essential mission to educate our students in the state of Arizona. So I think we've got a lot to be proud of, but we're still losing sleep every night, as you say, because the mission continues. It's not over yet. The good news is we're able to scale up rapidly because our incident command system is still in place and very high functioning. Yeah,
Rich, I think, we have the whole of last year and even the spring semester of the year before, and all of the things that we've learned, and I'm very appreciative of and proud. We should all be proud of the job we did last year with limited numbers of severe illness and hospitalizations. I know we all look at the trends of what's going on in the hospitals and are in close contact with the hospital leadership around the county, at least in southern Arizona. And there's a slight trend toward things getting better, But as you always say, we can't be complacent. And the difference this year is we're building on the knowledge and the system we had last year, but we're also armed with the vaccine. So the number one effort is going to be try to convince people who are not vaccinated to get vaccinated. It'll help protect them. It'll help protect others, and it will start to eliminate options for this deadly virus to continue to mutate and see new variants coming. Also, Rich, you know, you're in at the highest levels nationally, and I'm assuming that the FDA is going to give approval to at least the mRNA vaccines, hopefully soon, and maybe that'll give people who are on the fence or are hesitant some comfort that they can move forward with vaccination. But vaccinations are key. We've got to get as many people vaccinated as we possibly can, but testing is also going to be a big key. And I'm just so appreciative to Dr. Pepper and the whole team for the continued vigorous assessment of wastewater so that can guide our testing. And also, if we find pockets of symptomatic positive individuals through contact tracing, we can expand our testing. I think testing continues, even if you're vaccinated. Look, if you're vaccinated, fully vaccinated, and you have symptoms, you should get a test as soon as possible, because there are breakthrough infections that occur. The good news is the vaccine will protect you against hospitalization and death. But testing is going to be really important, and maintaining adequate social distancing. I like the face covering policy and the approach we're taking, but still assume everyone's unvaccinated, assume that even if they are vaccinated, that they could still be carrying it, and just be careful out there, especially when you're in close settings with others.
Yeah, you know, Bobby, I think it's worth reemphasizing. Last year, before we had a Delta variant, we spoke a lot about variants and mutations and such, and told people this was what's coming around the corner. And if we don't get vaccinated, if we don't continue to practice these good public health practices, we're going to get a variant. And here we are with Delta. And the public should be reminded that if we go back to SARS and MERS, those are coronaviruses, and they've mutated. Okay, and this virus is going to continue to try and stay alive. The only way it can stay alive in our environment, in the nation, or the world is to find places where people aren't vaccinated. And when they are not vaccinated, for all the people listening, what happens is that virus then has a chance to change itself, what we call a mutation. And then that arrives at another variant. And there's a few out there now that are being studied. The best way for us to stop this virus from mutating and transmitting is for everybody to get vaccinated. I'll remind our listeners as well, for those of us who are a little older, think about polio. You don't hear about polio anymore because Sabin and Salk came up with vaccines back in the 50s, and we pretty much eradicated polio. Some of the other vaccinatable diseases, all of you have children, measles, mumps, rubella, tetanus, whooping cough. We don't see those diseases when people are fully vaccinated. This is nothing new. So I want to emphasize to everybody listening, this is just another tool in our toolbox of diseases that we're going to find now with COVID and in the future, that we have the ability to make these vaccines. We should be using them not only to protect ourselves individually, but our communities, the nation, and in fact, the world. Because as long as the world is not vaccinated, those viruses can keep circulating, even though we may be vaccinated in this state. That's why you hear our government is looking at, and many other nations as well, taking their excess vaccines and sending them to third world countries. And people question, why would we do that? It is to help them, but it's also to protect us and stop the transmission of these viruses. As long as they're being transmitted, they're mutating, and sooner or later, you're going to get a mutation that is going to make our vaccine less effective, and we have to start all over again. So as the president said, please, everybody get vaccinated. There's no excuse not to. If you have a medical reason, religious, we understand. The governor has even said, encouraging people to get vaccinated. So let's make sure, let's get everybody out there and get vaccinated. That's the best thing we can do right now, along with the good public health practices.
Are you ready to go to questions?
I think so.
Yeah.
All right, our first question comes from Charles Fishman from the Atlantic. Good morning, Charles. Welcome back.
Good morning. How are you guys?
We're great.
We're well. Good to hear your voice, Charles.
Hey, Charles, nice to see you back.
It's nice to see everybody's face. So I'm just jumping back in to keep up literally a year. It's hard to believe that it was a year ago that we were all trying to figure out what was going to happen in the coming year. Some interesting things have happened just in the last week. And I just wanted to ask maybe two questions about that. Dr. Robbins, you announced a mask mandate. Is my camera's not on? Could my camera be? You guys are in control, I think. I got all dressed up and you didn't turn my camera on. On Wednesday, I believe you announced a renewed indoor mask mandate that you just alluded to at the start of this briefing. If I was following things correctly, Arizona State, Northern Arizona University, and then you guys at ASU, sort of in the space of just a couple hours, right on top of each other, said, we're not going to abide by the governor's ban on requiring masks. We're going to require masks. And I'm curious how that played out on you all's end. That is, was there conversation internally? Was there conversation university to university so that you all sort of presented a unified decision? Since then, the governor has said your requirements won't hold up in court. I'm not sure what he bases that on, but I'm curious about if you can give us a little color how that story went, and I'm sure the decision went back a couple days. And then the second question is, you all have literally as the second item on the COVID updates page, a system for faculty, staff, and students to upload an image of their vaccine, whatever it is, your vaccine card, your vaccine certification, into a HIPAA compliant system. So basically into your health record with the university. And I'm curious if you can tell us why you want people to do that, and what percent of faculty and staff are vaccinated, and students, if you know, and are people actually going ahead and uploading their document into the system? So two kind of big questions.
Two big questions, Charles. We could spend the rest of our time on these. Rich, I'll try to take both of those. I'll take your second question first, Charles. We're not requiring that people upload their vaccination cards, but we really want them to, so that it gives us, because as you well know, we can't ask people if they're vaccinated or not. That's part of the state law. And, it bleeds into your first question about the governor's executive order, and then the law that I understand takes place in sort of September 20th timeframe. So we're working still under the governor's executive order, and he was silent on the face covering issue. So we're not in violation, and I'll let Rich clean up what I'm saying here, because I may get off track, or Holly can help me. It was really the intent was not to treat people differently based on asking about vaccination status. So then to get more granular with your question, yes, there were lots of conversations between the presidents of our three universities, our governing board, the Arizona Board of Regents, the governor's office, and we talked through this, and we're all in a good place, I think, that we came to consensus that, look, if you are outside, we're not saying anything about masking, although I would say even if you're outside, it's a good way to protect you from the sun of Southern Arizona and skin cancer. So I would argue just wear your mask all the time when you're around other people. But if you're outside, the chance of transmissibility dramatically decreases. If you're inside, and let's just say there's a classroom that can seat 100 people and there are 10 students and they're adequately spaced out, maybe you could not wear a mask in that situation. But we're anticipating there's going to be lots of enthusiasm from both our faculty, staff, and students about coming to class. This is going to be an exciting time for us, and we're confident that we can put the guardrails in place to safely allow us to have great in-person teaching and learning for our students. We're all very excited about this. Now, Charles, I can't remember if I got all of your questions. If you want to clarify or a follow-up, or if Rich, you want to add anything to what I just said.
I think you covered it well, Bobby.
I'll ask two quick follow-ups. Are classes running at standard capacity? Are dorms running at standard capacity, full capacity?
Yes.
And are you doing wastewater sentinel testing again?
Yes.
Yes, and yes. 3 yeses in a row, Charles.
Everything's at full capacity, and there's no requirement to be vaccinated to move into a dorm?
No.
Okay. You have confidence.
I do have confidence, but I'll say it again as I've said it every time, and Charles, look, we all know if we could, the UC system, for instance, is requiring vaccinations, and many other places are. We can't do that in the state of Arizona. And so we've got to do the best we can to make it as safe as we possibly can. But I am begging, I'm imploring, I'm asking everyone, I'm expecting everyone to get vaccinated before you come to our campus, but I cannot require it.
All right, we'll move to the next question. It comes from Megan McNeil from KOLD. Go ahead, Megan.
It feels just like the old days. Everyone's back together. Charles is back on the line. Oh my goodness.
Too bad we can't see him. He got all dressed up and nowhere to go. Charles, we wanted to see.
I know. I'll say I'm not dressed up, so I'm glad Charles is. So my question, I guess, kind of hops off of his. I kind of have a few, but talking about wastewater, I know that kind of the main tactic that y'all used was to trace, treat, and then isolate, right?
Yes.
Does the isolation not also go against some of those state laws that we've seen come down, and why not?
Yeah, I don't think it does. How would isolate if you're a positive case? You need to isolate away from other people because you're emitting virus and you can infect others. So you need to be isolated either in one of our on-campus facilities, or you can isolate yourself off of campus. And I don't know, I defer to Holly and Rich about if that's even controversial. I haven't heard that one to be even remotely controversial.
I haven't heard that.
None. There's no controversy as far as I know.
Because Megan, I think if you get a positive test, whether you're vaccinated or not, you can still need to isolate.
Yeah, that guidance hasn't changed at all. And we haven't heard a single thing. It's not covered in the legislative laws that were passed. I mean, it's just good public health. And I think that's the conversation we've had all along, is that we are going to, even if you're based on vaccination status, keep isolating those who test positive to keep the spread to a minimum.
Okay. Fair enough. Maybe it was just a K through 12 that I was thinking of. It's hard for me personally to even keep track of all these changes. But so my second question is, Dr. Robbins, I've heard you say several times on these calls last year that you're a proponent for vaccine mandates, for a vaccine passport, if you will. Do you see any of that happening when FDA approval does happen? Since there is a little bit of pushback against these mask mandate bans, do you think there could be a little bit of a pushback when it comes to vaccines once FDA approval is there?
Well, as I said before, I'm hoping that will convert some of the people who are on the fence about their hesitation to take the vaccine once the FDA approves it officially, which I think, and Rich knows better than I do, but I'm told within weeks to certainly a month that will happen. But it's not going to convince everyone. And so you're getting to the vaccine passport issue. I would love to be able to use that, but again, we can't. Now, we could get into a whole constitutional states' rights versus federal rights if, for instance, the federal government all of a sudden passes some law that says you've got to show proof of vaccination before you can get on an airplane or, go to a sporting event or whatever. I think that would be long drawn out. And the easiest thing is everybody just get vaccinated. If you can't, if there are medical reasons, we understand that. I got emails about some cultural and religious issues with some of our students and faculty and staff, and I understand that. Of course, we're going to be very flexible about that. But the fact is that if you can't be vaccinated, then you're at risk of getting infected, and you're at risk of infecting others. So we talked a little bit last week about, calling on your inner altruistic self to try to protect others around you. And so I think, President Crow talks about educate and enable people, enable them to get the vaccine easily. And also we're going to have pop-up kiosks all around campus for easier testing. And I'm encouraging everyone, certainly if you've got a symptom, even if it's, just a common cold or, garden variety influenza, go get tested, because we want to know, and you want to know if you have COVID-19 so that you can isolate.
Right.
Sorry, muting issues. Our next question comes from Christina Duran from Tucson Local Media.
Hello, good morning. I have two questions. So my first, I was wondering if the number of vaccinated students that have uploaded their vaccination status has increased since the last time we spoke.
Yes.
Yes.
Yeah, I think seems like I've forgotten if it's Friday or Sunday. There's one day of the week where we get lots of uploads. And just in one day, since we were on last week, I know there was one day where there were 500 that came in. And I'm assuming, and we're going to ask people when they come back, please, if you haven't uploaded, we're going to make it really easy for you. A couple of clicks and you can upload and you're good to go.
Yep, the day is Sunday. Typically, our biggest day is Sunday to see our vaccination uploads. We had a discussion about this a little bit this morning, Christina. Now that Campus Health is in charge of doing our vaccinations here, those uploads will be automatic. So we should see, as people come in to get vaccinated, we should see those numbers rising significantly throughout the semester.
Actually, I did have a follow-up on that. So I saw that there's some incentives for students and staff to get vaccinated. Would those incentives come in as soon as they upload their vaccination status? Is that like a raffle sort of thing where maybe they can get a Zona pass or something like that? How would that work?
Yeah, I think you have to upload your vaccination proof. And the good news is it's not just for new people. anybody who's been vaccinated can participate in these incentives.
Yeah, and we can't actually legally do raffles here, Christina, but what we do is we're doing it on a reoccurring basis. So as the semester progresses, we do at random choose those names of those people, and that'll be an ongoing process throughout the rest of the semester and probably throughout the rest of the year.
Awesome. And then my next question is the FDA just authorized boosters for immunocompromised individuals. Would the U of A be offering that as well in collaboration with Pima County Health Department?
Yeah, I think the answer to that is yes. And I would encourage people, and I think, Rich, you can tip me on this, but if you're sort of 6 months from your last dose, then you're immunocompromised, or even if you have a question about whether you're immunocompromised. I think, we've talked about immunosenescence. As you get older, your immune system doesn't work as well. So if you're over a certain age, certainly if you have a known immunodeficiency or you're receiving drugs that would decrease your immune response, you've had a transplant, you've got an autoimmune disease like lupus or rheumatoid arthritis, just check with your physician. But absolutely, I would encourage people to get that third dose.
And it's, I would add then, the suggestion is for the mRNA type of booster, number one. And two, you can do it as early as a month after your last, because the data is showing that most immunocompromised people mount a small response. Some don't mount any response, but interestingly, some mount a response, but it's not as much as a normal person. So FDA has approved that, but suggesting that it should be an mRNA vaccine, and as early as a month after their last dose is okay.
And the other tool that we have, which is fantastic, is our antibody testing. Mm-hmm. So if you want to know your antibody status, this is a great time. Remember when we first started this, we had hope that there would be a vaccine, but didn't know when it would be. And we wanted to use antibodies as a way to identify those who had COVID-19, because the testing, if you're not shedding virus, you may not test positive. But if you've had the infection, your antibodies, and now we can say in most individuals, it's up to a year to 18 months you produce antibodies. But if you're curious, you can come to the University of Arizona and participate. It's a statewide antibody testing program. And I would encourage you, if you have any questions, get your antibodies, because there's some interesting data there. It helps us answer the question if natural immunity versus vaccination is better. And Rich, we've heard the mantra, well, I had COVID, I don't need the vaccine. Actually, if you've had it, the vaccine will give you a booster. Absolutely. And give you even more protection than even your natural immunity.
Right. Yeah, I think the last thing I'd add to Bobby, what you said is that by coming in and getting your antibodies testing, you're actually contributing to a national database that helps us define how these vaccines work, but not only in you, but we need to look at youngsters, old people. We need to look at difference between males and females, people with immunocompromised immune systems and good immune systems. So you need thousands of data points to be able to make those decisions. So you're not only helping yourself, you're actually contributing to the database that will help us solve the bigger problems.
Yeah, and Rich, I think we both know two heart transplant recipients, one of which got the vaccine and had a great antibody response, and the other who got both vaccines and didn't have such a good antibody response and actually got COVID-19.
Right.
So the antibodies are really, really good at telling us what the status is if you get the infection, how well you can fight it off.
Mm-hmm.
I have to say, getting my antibody test provided great comfort in knowing that I was actually right in the mid-range of where strongest to weakest and not, in my ability to protect myself from the virus.
Right.
Next question comes from Rocio Hernandez from KJazz, and she wants to know if there will be any consequences for students or staff who don't want to wear masks, and are there any opt-out provisions?
Yeah, there's got to be some opt-out provisions. For instance, if you have respiratory issues, and I think we're still trying to, a week away. You talked about the law students and the fine arts students coming back to class. Welcome, by the way. We're excited to have you back. Looking forward to move in for most people starting on this Wednesday. So yeah, there are going to be some opt-outs, I would think, although maybe there's some face covering or some other, shields or some other way we could handle someone who has severe respiratory issue. I would kind of offer that if you've got severe respiratory disease, maybe you don't want to be around other people. Then the consequence thing, I think what'll happen is, let's just say we're in a 100 seat classroom and there are 90 students there. By definition, you can't have adequate social distancing, which, by the way, just stick your arms out. If you can helicopter around with your arms out. And if you're touching someone, you're walking in a hall and you can't, people aren't away from your arms outreached, then, you should wear a face covering. But the way it'll work is, I think, whoever's leading the meeting would have a conversation with someone privately about, hey, we're not socially distanced here. The guidance from the university is we need to have your face covered. And if you can't do that, we're going to ask you to leave the class and, take the class remotely. And if there's persistence in it, I think that at least for students, it would be referred to the dean of students to adjudicate. And for employees, it would be referred to their supervisor, whether in the academic track to the department head or dean, and to the staff side, whoever your direct supervisor is.
It's also worth noting that we've put masks or face coverings in every single classroom on campus so that they're readily available to everybody who comes into those rooms, whether you forgot it or not. And then we're still offering those face coverings at the bookstore to our students for free. So I think those are some of the mitigation efforts that we looked at over the semester to just make sure we were doing right by all public health standards. Megan has a follow-up from KOLD. Go ahead, Megan.
So I had reached out to the governor's office last week about the mandates, and they call these mask mandates, quote, toothless, unenforceable, and will not hold up in court. So one, what is your response to that? And two, how concerned are y'all about a court battle over these mask mandates?
Yeah, I don't really see them as mandates. I see them as expectations and requirements, and it's following good public health practice. I mean, Rich and I are, we're more focused on public health and safety. I'll leave it to others in the policy and legal realms to decide whether, whether this is enforceable or upheld in court or whatever language you want to use. Look, we're trying to keep the university open so our students can come to class and learn and progress toward getting their degree so that they can either go on to graduate school or professional school or go and get a job. And people are eager to do that. So we're going to do the best we can to make it as safe as we possibly can. And the best way is to get everybody vaccinated.
Right.
everybody that comes on our campus vaccinated as best we can, and to use these other mitigation efforts. And, you know, I think we're on firm, good ground to do what we're doing. And, and I'm excited about having students and faculty back. And I think most people are excited to be back if they, you know, if their choices. If you don't want to come back, you can always take classes remotely. And, you know, I just think that for the majority of people, they're going to feel comfortable. Certainly once the vaccine gets FDA approval and more people get vaccinated again, that is the best weapon we have against this deadly virus.
Right.
Our next question comes from Steve Jess. Go ahead, Steve.
Thank you. Dr. Robbins, last week, your university, the NAU and ASU all almost simultaneously announced your mask expectations. Can you go into a little bit more detail on the behind the scenes conversations that took place before those practically simultaneous announcements came out?
Yeah, I think Charles Fishman asked that question earlier. There was a lot of conversation between our three universities and our governing board, the Arizona Board of Regents. And, you know, because ASU was starting a little bit earlier, they kind of went out first. But the idea was we would have unified language and we would all go out essentially simultaneously. We were a little bit slower to get out, but you know, within the same day, NAU, ASU, and us came out with our statements. So yes, there was definitely discussion for several weeks working on this about how we could thread the needle by providing the maximum amount of protection to our campus community, but also adhering to state law.
All right, we have one follow-up from Charles Fishman, and I'm not sure if he wants us to open his mic or not, so we'll give him a little opportunity by opening his mic, and if he's not available, then I'll just ask it from the Q&A. Go ahead, Charles.
I'm always happy to talk, as you guys know. Dr. Robbins, I was curious, and I may be covering territory you guys have covered in an earlier briefing a week ago, but all classes are meeting in person at routine capacity in the vast array of meeting rooms and classrooms. If I am not comfortable going to class, are all classes also going to be available on video? Are they going to be available in real time and, archived like they were last year? And if all those classes aren't available on video for sort of remote learning, how are you deciding which ones will be?
Yeah, that's a good question, Charles. I think the toughest thing for professors is to try to do the hybrid approach of having some students in the classroom and some participating remotely. And I think it's going to be a class by class decision about that. But I think there's some professors who will be able to pull that off. You can imagine if it's a large class, it may be more difficult. But I do believe that each of the classes will be videoed and archived so that students could at least, if they weren't able to come to class or to participate in a remote hybrid type of approach, could at least watch the class and hear the lecture. We'll have a better answer for you, but again, it's hard to say university-wide since we're going to leave it up to each individual professor to figure out what works best for them in their classes.
But I'm sorry, but your impression is that all classes will at least be videoed so that somebody who can't be there or is not comfortable being there will be able to watch what happened, even if they can't participate in real time.
Yeah, I think for the vast majority of classes, that's correct. Provost folks may be watching this and saying that's way off base, and if it is, we'll send out something immediately clarifying what I'm saying. But I think for most of the classes, because as you can imagine, Charles, we had to ramp up very quickly last, March of 2020 to be able in a couple of weeks to deliver everything, remotely. So I think we've got the capability to do that. And that's my impression that for most classes, they will be recorded.
We have one more follow-up from Steve Jess. Go ahead, Steve.
Yes, thank you. For either one of you, does the university anticipate changing its vaccine policy once the COVID-19 vaccines achieve full approval from the FDA? That is, would it be added to the list of vaccines that are required for students to attend?
Wow, that's getting into a very interesting discussion. I think for the near term, the answer to that would be no. But it's amazing to me that nobody ever questions MMR, right? Right. Everybody just goes and there's some people who do. There are people who just don't want their children vaccinated with anything. But you bring up an interesting point of right now we require that if you attend the University of Arizona, you've got to show proof that you've had MMR vaccine. Now, one of the things that I would be interested in exploring would be obviously to expand that to COVID-19. That's not going to happen anytime soon. But what about just regular influenza? To get your flu shot, Rich and I, to keep our hospital privileges, we've got to go get a flu shot every year. That's required in order to go into a clinical setting. The rate of regular garden variety influenza vaccine at most college campuses is in certainly less than 20%. It's probably closer to 10%. I would love to see us require that. You got to get a flu shot to come back. The good news is with all these things that we're doing to mitigate for COVID-19, not shockingly, it works for the common cold. It works for most varieties of influenza or any respiratory transmitted disease. So you bring up an interesting point that I think we'll get to one day, but I don't see us mandating vaccinations to attend the University of Arizona in the near term.
We have one final question, and it's from Rocio, and she says, I wanted to ask what made the universities change their minds on masks from strongly recommended to now requiring them in certain settings? Did you get any new health, public safety, or legal info that you could do that made you confident that you were able to do this?
Yeah, I think we always saw a legal pathway forward. And as we got more and more data about the utility of face coverings, but it needs to be a good one. It needs to be an adequate one that will inhibit the penetration and exit of respiratory particles. But I think that, I said it last week, my goal was always to be able to require, I said last week, I expect everyone to do it. And over the course of the week, in talking with the other universities and Arizona Board of Regents, we got to this place to say, look, this is what the CDC says. We're trying to do the best we can to follow good public health practices while staying within the scope of the executive order and subsequent law. So I think we've achieved that. I think we're going to be able to protect people as best we can. But the number 1 through 9 is get vaccinated. Get as many people vaccinated as possible. Second is to cover your face. Third, wash your hands. This is the same thing we said every time last year, and we'll continue to say it every time this year. And the other one that I think is going to be critically important, regardless of your vaccination status, is testing. We've got to be able to have testing. Antibody testing, which doesn't help, you know, in the heat of an infection, but it does give us great information about your history and how many antibodies, you know, degree of antibodies you have going forward.
Well, those are all the questions we have. Any final remarks from you, President Robbins or Dr. Carmona?
Rich?
Just want to, as the president has said, and we've said since last year, do the best you can to get vaccinated, stay socially distanced as much as possible, wash your hands frequently. We can get through this year again, as we did last year very successfully, but we can't do it without all your help and compliance.
Yeah, I saw something from President Crow where they talk about forks up, sleeves up. Well, we say vax up, mask up, and bear down. We'll see you next week.